So a lot of younger doctors that are there, and maybe say they would want to pursue their clinical practice, but at the same time wants to explore some part of the management or health tech side of the things.
It's an exciting time if you're a doctor and you want to explore the business side of healthcare. I think there are much more opportunities out there, much more awareness, much more acceptability out in the business world to get in doctors, right? Because they know the next
Hmm,
wave of development will include healthcare for sure. The past wave was more
hmm.
around finance, getting to e-commerce, but the next set of innovation will include healthcare in a very big way. So it's exciting time for doctors.
Saw that you also work at Apollo Hospital and maybe
Yes.
say directly with Dr. Reddy or the family.
I mean, it was a very great experience. I would like to thank the whole Apollo family for having me. My role was working with Dr. Reddy, who's the chairman of Apollo Hospitals at Chennai. I was also working very closely with Dr. Preeta Reddy, Sunita Reddy, Sangeeta Reddy as well.
Also mentioned that a lot of your patients are coming from tier 2 or maybe say tier 3 cities. So any specific percentage, maybe say how would you draw a pie tier 1 and metro versus tier 2, tier 3 city right now?
So I can give you the stats around tier 1 versus tier 2, it's 50-50. So the major thing that we are seeing, right, as a tectonic shift is patient behavior change, right? Patient today
Mhm.
is asking for care at home, right? At my own convenience, I want care. I want care which is personalized to me. The two different things. And then I have the
Okay.
money I want to spend. And that's a very specific niche. And that's slowly
Hmm.
evolving into, larger population sets, right?
Got it. That's one of the core agenda for Navig also. I mean, that's what we
Yeah,
believe in, that the hospitals and health tech companies should very closely work with each other.
absolutely. A couple of
Yeah.
weeks back,
So,
I was at a conference where folks from UK had come down to India to look for these kind of technologies where they can,
uh,
take them to UK and set
okay.
their own business up. So yeah, I
Wow.
mean, the world is evolving. I just hope that hospitals in India also, wake up and, explore opportunities amongst us.
Today, my guest on the Navig Health podcast is Dr. Vineet Nair. Dr. Vineet is a clinician who completed his MBBS from Bangalore Medical College and later pursued an MBA from ISB and the University of Michigan. With over 10 years of diverse experience, he has worked in clinical roles as a clinical researcher in the US and strategy and consulting roles at Deloitte and Apollo Hospitals. Currently, he is the Chief Medical Officer at one of India's top digital therapeutics company, Fitterfly, focusing on improving India's metabolic health. With his diverse set of experiences, Dr. Vineet is a thought leader in consumer health and metabolic wellness. In today's episode, we discuss with Dr. Vineet about his career transition from a doctor to an MBA graduate, his work as a strategy consultant, and his current role as CMO of Fitterfly. For young doctors wanting to explore the tech or management side of Indian healthcare, we will talk about practical ways and opportunities. Then we dive into Dr. Vineet's role at Fitterfly and how it's changing the course of the diabetes for millions of Indians. We cover aspects of building and running a successful health tech company in India, such as onboarding doctors, India's changing patient behavior, solving lifestyle diseases through community and human behavior, and the regulatory framework for medtech companies. If you like today's discussion, please subscribe to our YouTube and LinkedIn channels. We have many more guests who will join us to discuss everything on the business side of Indian healthcare. Let's get started.
Dr. Vineet, welcome to Navig Health's podcast. Very delighted to be hosting you, and we look forward to having a wonderful session with you to discuss two core things. One is digital health per se, and also the broader Indian healthcare ecosystem. So, those are the two things that we plan to discuss with you. And the objective for the next 45 odd minutes is to borrow the learnings that has come from a decade of your experience of working both as a clinician in a plus in a consulting and a health tech role. So, and what stands out is that you have touched upon multiple segments within the broader healthcare industry. You have worked in hospitals, in a global consulting company, in a pharma side company, and now working for one of the top digital therapeutics company of India. So we will begin by asking few questions that would help us understand the journey from being a doctor in a hospital to the current role of CMO in a health tech company. Then we would love to hear about your work and role at Fitterfly. And later we would move to broad questions to get your perspective on various aspects of health tech, digital therapeutics, and the broader Indian healthcare ecosystem. I'm sure our audience will love the discussion we are having with you. Thank you on behalf of the entire Navig team and our audience for joining us today. Let's get started.
Thank you, Chirag. Thank you, Navig team, for inviting me. It's exciting that, to be part of a really good initiative, and I really look forward to having a really wonderful chat. So, my name is Dr. Vineet. I'm the Chief Medical Officer at Fitterfly. I'm a physician by training. My journey began as a physician. I finished my MBBS from Bangalore Medical College. I worked briefly in India. I've also worked as a medical student during my internship in the US. One thing, however, I really missed that our health system was really lacking in innovation. The use of technology was very, very limited. I wanted to explore a career where, where I could leverage both healthcare, the technology, as well as, a lot of new innovations and that can improve life. So when I finished my MBBS, I realized I could use a lot of technology in driving change where things have where there are a lot of areas of unmet need. So what I really looked at it was rare diseases. I explored a rare disease called pulmonary arterial hypertension back in the US. I did genomics research for 3 years, right? I wanted to pursue my education in the US, but unfortunately, due to my choices, it didn't work out. So we had to make a decision to come back to India and, leverage that kind of experience done in the US into India. Decided, gave it a deep thought, and transitioning to a role where healthcare leadership is required, I decided to go for an MBA. And due to my research, I figured out Indian School of Business was having a great program and a great opportunity for someone like me coming from a diverse background to explore opportunities post an MBA. So during the MBA, I had a really good time. I worked on, equipping myself with business acumen, strategic thinking, which was necessary for innovation in the healthcare space. So today I stand here at Fitterfly, and I'm able to leverage my clinical expertise while spearheading a lot of initiatives that leverage technology to improve metabolic health outcomes at a population level. So what I do at Fitterfly is essentially, designing therapy, which involve a lot of, human connect as well as technology, bringing people closer to what is important. In diabetes, obesity, and hypertension, lifestyle becomes a very, very important tool to manage it, both at the early stage as well at the advanced stages. So we design therapy, we test it out, we run it with thousands of people, we do clinical research on that data and present it. So my role essentially encompasses everything that a medical doctor does, but at a very startup-like environment.
Got it. Got it. So I think thank you, Dr. Vineet. What I might do is because we had some detail level questions just covering some of the things that you have discussed. So we might just touch upon some of the areas more deeply during
Absolutely.
our discussion.
Right.
Yeah. So I think great that you started your journey as a clinician, as you said. You also you wanted to pursue further education in US, but that didn't happen. So with some kind of experience from the US, where you got exposure to technology side of the healthcare, and that's what motivated you to pursue do the I would say management side. I mean, that
Right.
was the trigger point, or were there any other trigger points that you remember from those days?
That was one of the trigger points for sure. And there were a lot of people, right, who were helping a lot of pharmaceutical companies globally, right? One of the names that really come up
Hmm.
was Dr. Narasimhan. He is currently the CEO of Novartis, right?
Hmm.
So I looked at his profile.
Okay.
Incidentally, he was one of the college friends of my, advisors in the US. So both of them went to med school, but this person went to McKinsey and did consulting and did an MBA,
Uh-huh.
and he's heading Novartis, right? So whereas my boss went into clinical sciences and he was a
Uh,
physician, cardiologist. So I looked at it, right, and I was really impressed with the kind of impact and the like the ability to change, right, life, right, at a global level. As a doctor, I saw
hmm.
that you're kind of limited by your geography and opportunity that you get, right? But as a leader in the healthcare space, if you are at a big company or even a smaller company, right, with
Hmm.
technology, the ability to impact a lot of lives with a small amount of resource becomes possible. So that was another triggering point, right? Can I become somebody like him, right? Can I also make a big difference? And other things were like what was new, right? What was upcoming in the trend? Becoming a doctor was no more in the fashion, right? People
Hmm.
were looking
Hmm.
at bigger things, right? Crypto was, I'm not sure if crypto was popular back in that day here, but when I was in the
Yeah.
US in the early
Okay.
2015s, crypto was very popular. So people were talking about the power of Web3, crypto, the
Got it.
technology coming in. So what can that do to healthcare was something that I was very much excited for. So I wanted to explore that area as well. But the basic lacking of MBA was
Hmm.
definitely there, right? All these people did an MBA from a great school. That was
Uh,
a motivation, to figure out what is the best place I can get in.
got it. And how was your reaction I mean, from parents or family? I mean, they were all supportive about this decision, or you come more from a medical family where,
Yeah. So I do not come from a medical background. None
okay,
of my parents or very few family members are doctors, but the decision not to continue was definitely not welcomed in the family, to
okay,
say the least, because it's very,
okay,
very new for them, and they also had to consider what will they tell others, right? Abhi to doctor
okay.
nahi hai." Right? So that's what was a barrier, I would say,
Got
but
it.
I could navigate through that pretty easily. Tell them this is a good school, and
Mhm.
this is what I want to do, and makes my life easier. I don't have to
Got it.
struggle in the PG section for
Got it.
like 3 years to five
Yeah,
years.
yeah, yeah. No, I think that's the typical choice a
Yeah,
lot of MBBS doctors do take. But in the last, I think 4 or 5 years, people are more open in terms of taking
absolutely,
a different route for the clinicians
absolutely,
also. So, I
because of the
mean,
awareness.
good for the system, but yeah,
Yeah,
that's right. That's right. And you did a full-time MBA, right? If I'm
yes,
correct.
yes. It's a full-time
It
MBA
was
from
a
ISB.
1 year or a two? It's a
So
1 year
ISB
course
only
that you
offers
had.
1 year full-time MBA for it's called the PGP, and there are courses which are longer
Got it.
duration, but it's for working professionals. Like you work at the same time, you do an MBA in the weekend. So
Hmm.
that goes up to 1.5 years. So the course that I
Okay.
was in, it's called the
Okay.
PGP. It's a 1 year full-time residential course.
Understood. And how big was the class and how many doctors were there?
Yes, good question. So we have two campuses, Hyderabad and Mohali. Hyderabad campus had close to 700 people.
Mhm.
Mohali had about 250 to 300
Okay.
people. So close to 900 in total. And doctors, I
Hmm.
think six doctors and a dentist. Yeah.
Okay. Okay.
There were
Okay.
PhD doctors as
And
well. There were medical doctors. So it was a diverse group.
got it. Got it. And from a doctor's perspective, I mean, having a clinical plus MBA degree, what did it change for you? I mean, where is the maximum leverage you see that the MBA course or the entire experience that you would have gone while doing the MBA course is
Right.
helping you in your current and maybe say also some of the future roles that you might be playing?
Right. So what MBA is essentially is it teaches you all parts of a business, right? If you want to run a
Hmm.
business, here are the 10 things. There is a course on that. There is finance, accounts, strategy, marketing, human resource, legal, everything around that, right? Digital marketing,
Yeah.
like everything around. Like if there is a software led thing, there is a market, there is a course on that. There is healthcare related business, there is a course on that.
Hmm.
There is operations courses, there is healthcare operations courses, everything, even filmmaking, there is a course on that. So whatever your
Okay.
niche
Wow.
is, you want to pick a particular
Ah.
course and pick a stream, you major in it, you're done. But end of the day, with an MBA, you know how a business should work. If you want to start a
Mhm.
business and if you want to join a big company, you know what are the major parts of that company, and you can pick and choose which is something that you want to spend more time on. So you after an MBA you get into jobs where it's like a management trainee where you're not sure,
Hmm.
right? Where you work at different departments of a organization and learn, and then you grow there. You can get into management consulting where you can work with leaders of these companies to solve their day-to-day business cases, which
Hmm.
could be like 3 weeks to 4 weeks or up to multiple years. So depending on the kind of projects, you will be allotted those projects and the company. After people also go through product management, like a lot of these health tech apps you're seeing, like they need people like us with a
Hmm.
medical background plus an MBA to run product. run their product, right? As product managers, right? We bring in the ability to, understand the patient's
Uh,
journey. Where does the therapy come in, right? And what are the therapy's advantages, the value proposition? How do you communicate that, right? That is where a doctor comes in and plays a crucial role. And then how do you manage the operations? Because we have learned operations back then,
hmm,
you kind of translate that knowledge to your organization, run it efficiently, track all the metrics which are important, and then reevaluate, realign, remeasure, and then do better things with that information. So as a clinical doctor, you may not be aware of all the things that needed to be done in a business, but with an MBA,
hmm,
you are at least you're given the information that this is how a
hmm.
business needs to run. If there is a change need to be made, this is how a change need to be done. And then be a
Got
leader, right? All this experience of working with teams, cross collaboration helps us become better leaders and be more effective in our work.
Yeah, I think very important because I think at least what I have seen is that a lot of doctors do feel, I mean, even if they do not want to leave their clinical practice, but there is a good, I think, exposure to this management or a health tech type of a thing would be really, really beneficial for the entire ecosystem. I think once
Correct.
the, I would say the vision and the thoughts of a doctor just broadens, they might themselves be able to make some changes in their own hospital or a clinic.
Absolutely.
So a lot of younger doctors that are there, and maybe say they would want to pursue their clinical practice, but at the same time wants to explore some part of the management or health tech side of the things. For doctors who would like to continue their clinical work in a hospital or a clinic that is there, but at the same time they have the aspiration of maybe say getting involved in a health tech a startup that is there or some kind of a management role, then according to you, where and how can these doctors get started? Any platform that gives such type of exposure to the Indian doctors? I mean, not a full-time MBA, but
Right.
any thing that you have seen in the Indian context?
Great. And that's a great question, actually. I mean, it's an exciting time. If you're a doctor and you want to explore the business side of healthcare, I think there are much more opportunities out there, much more awareness, much more acceptability out in the business world to get in doctors, right?
Hmm,
Because they know the next
hmm,
wave of development will include healthcare for sure. The past wave was more
hmm,
around finance, getting to e-commerce, but the next set of, innovation will include healthcare in a very big way. So it's exciting time for doctors. My first suggestion would be look into their own practice, like the place they're practicing. How do you plan to
hmm,
digitize it? That's a step one, right? If they're
hmm,
not practicing in a digital environment, there are multiple options available, multiple platforms. I'm not going to take names, but there are n number of platforms they can, adopt, try it out, see
hmm,
what makes them work efficiently, faster, for example, right?
hmm,
Digitization helps in doing our same processes but helps us become more efficient, right? By doing so you can save your time, resources. You can save a lot of money as well long term, because you don't have to manage so much of information. You can see more patients, understand their problems better, and deliver care.
hmm.
And you can go back and see if your care has really worked, because that's the power of data, right? You can look at and generate insights and see if you're doing well over a period of time. So my first suggestion would be to how to you improve your practice using digital means.
Hmm.
Second step would be to collaborate, talk to startups or a hospital that would be interested in collaborating with you, right?
Hmm.
Let's say you identify a patient
Hmm.
who is really needing higher level of care. Let's say you're in a primary or a secondary care, but you see that a patient needs tertiary care, right? And you know a doctor who is working at a bigger hospital. Is there a platform to connect to that doctor, refer this patient, talk and get expert opinions? That's a
Hmm.
great platform to be, right? Get second opinion, expert opinion, refer them, so that life becomes easy for the patient, right? And it shortens the duration of care. So in India, major problem is patient have to go through various doctors. Referral is a big problem. You don't get the right channel, right? If there is a
Hmm.
channel that connects people with various requirements and makes their life easy, right? Your insurance might also be very much interested, right? If you can shorten the duration of care, right?
Got
For
it.
them it's a win-win money. Pharma
Got it.
companies are also interested to explore these synergies, right? Data is something that de-identified data here, I might add,
Hmm.
is very, very important for pharma to do clinical research, understand if the drug works, it doesn't work, what are the side effects. If there is a new drug, what are the potential areas of where drug can be improved? Is there a support required? Is there a nutritionist required so that the drug is taken for a long time and outcomes are improved? So these are the information very much important for healthcare players.
Got it.
And coming to startups like us, we need support of all the doctors as we can, right? We are trying to build an ecosystem where
Got it.
diabetes, obesity, hypertension is treated at the earliest stage or even at the preventive stage,
Hmm.
right? Identifying high risk
Hmm.
people. So we have the capability to build that technology that which doctors can use to identify these high risk people, right? Identify at risk people and then take them through a
Understood.
journey where the medication may not be the first requirement, but lifestyle could be the first option, and then this patient can be followed up regularly, and their therapies can be well managed.
I saw that you also worked at Apollo Hospital and maybe
Yes.
say directly with Dr. Reddy or the family.
Yeah.
Okay, so would be happy to understand, I mean, your experience of working with the family. I mean, what was the role and I mean, any different experience you had versus working for any other hospital, I mean, directly with the family? Because, yeah.
I mean, it was a very great experience. I would like to thank the whole Apollo family for having me. My role with was working with Dr. Reddy, who's the chairman of Apollo Hospitals at Chennai. I was also working very closely with Dr. Preeta Reddy, Sunita Reddy, Sangeeta Reddy as well.
Mhm.
So my role essentially was to look at few of the special initiatives they had. So they had a lot of initiatives around, COVID related work. They wanted to set up a,
Okay.
camp where, post-COVID therapy can be given. I was also deeply involved in Pro Health, like how will that program, which is essentially a health check program, be improved across India. We were also working very closely with BCCI, right? So that was a time where COVID
Hmm.
was there and they wanted to, continue playing the regular domestic cricket. So we had a big operations
Okay.
team supporting BCCI on, conducting all the games. So we had a team of doctors, nurses, right? All the technicians and therapists, which was actually manning and creating the bubble, though. So that year, all the domestic tournaments had a bubble,
Ah,
and Apollo was the
yes.
partner for
Okay.
that bubble all over India. And if there is a place
Wow.
where Apollo wasn't present, we would send teams. Even at Dharamshala, there was a team. Guwahati, there
Hmm.
was a team. Chennai, Bangalore, Nagpur. So I was kind of, control. I was in the control center of
Okay.
all these
Wow.
things. And yeah, 24/7, I
Very
would be
different
involved.
experience. Yeah.
Yes. So we did a lot of work around, a lot of potential strategic acquisitions
Hmm.
around startups, a lot of work around, evaluating different players, see where things fit in. So I was very grateful of working closely with the family.
Got it. And your MBA was after Apollo or before
No, it
Apollo?
was before. It was right after my work at
Before.
US.
Okay. Okay. Got it. Got it. So we would now move to understand your work at Fitterfly. But
Right.
before that, if you can just tell us for the audience, I mean, what is Fitterfly all about? What type of programs or solutions do they have for the patients? And how does this typically the program work for the from the patient perspective?
Right. So thank you for the opportunity, right? So Fitterfly is a comprehensive digital therapeutics platform which provides lifestyle management solutions for diseases such as diabetes, obesity, and hypertension. So we use the latest technology like the CGM sensor, the glucometer, right?
Mhm.
The BP machine, which can be integrated on a telephone mobile app, right? On the app, you can actually get to see all the data. Now, these data helps our coaches to build personalized therapies, diet plan, exercise plan, as well as mental health plan. Even if you're feeling stressed or you have lack of sleep, there is a solution on our application. If you have pain, shoulder pain, which is very common in diabetes, we have a solution. Application will guide you to certain exercises that can help you give much relief. And if you need help, you can always connect to with our coaches on the platform itself. So it's a one-way coach to coach connect. There is a one to many coaching as well. We call it
Mhm.
group therapy, where a coach gives out knowledge around a very specific niche area every day of the week, right? We also
Mhm.
have coaches, teaching about how to manage stress. If you have lack of sleep, how to improve sleep quality. We also have dedicated session on how to build habits.
Okay.
We feel there is a very common, reason why non-communicable diseases and metabolic diseases happen is because of our habits, right? So we have taken it as an initiative to help build habits, break the bad habits using all the scientifically relevant principles. That is the behavioral psychology. So we have a team of nutritionists, physiotherapists,
Mhm.
and psychologists who work in the back end, right, with the doctors as well, and giving out personalized lifestyle regimen that helps people take control of their diabetes, and then if possible they can also remit their diabetes. That means
Mhm.
that diabetes becomes comes in the normal range. They can stop the medications, right, the physician supervision as well, and then we can give them lifelong maintenance therapy for these kind of diseases. So that's the vision of the company, right? So that these people are not left
Hmm.
alone. Once managed, we want to take care of them lifelong and solve these
Got
their
it. Got it.
problems, day-to-day problems on our platform itself. So they might need XYZ items. We will be there to support them. You want a medicine, you want blood tests,
Hmm.
everything on a
Hmm.
single platform. Yeah.
No, I think that's really wonderful because for a country like India, where we know that, right now, I think we are the diabetes capital. Similarly, other chronic conditions also, the overall people would keep suffering. And with the, I would say, non-availability of the doctors and hospitals to actually treat the patient population, digital health or maybe say such type of initiatives would be required to maybe say maintain or even control this type of lifestyle diseases at scale.
Right.
So,
Absolutely right.
and I think one thing that you mentioned, overall the program includes the clinician, the nutritionist that are there. Plus, you also mentioned that a lot of psychological support that is there. So, do you also have some type of a community? Because I totally believe that this habit formation, the motivation in terms of, because see, awareness is already there. I mean, people know that smoking a cigarette is not good. Maybe say drinking alcohol is not good, but still we get lured to all those addictions that we keep having. And a few of the things that might really help is a community which might keep you motivated. Even a simple thing like going for a jog or a run or a walk. Do you have patients interact and maybe say communities inbuilt into the programs that you are having?
Absolutely, Chirag. So I forgot to mention that, but we do have community,
Wow.
which is actually, run by our coaches. I'm also part of that community. I come and participate in the sessions with them, right? All our therapies are actually in the community itself. Everybody can join in. So
Hmm.
this community we started last year. The overall objective was to, work on the engagement
Okay.
side, give out information, right? Let them know what's happening in terms of programs, in terms of their, whenever a
Hmm.
coach is available for an AMA, for example. But we saw a lot of people started using that platform to solve each other's problems, right? I'm a patient with
Got
diabetes. I
it.
have a
And
problem.
this is
I
on a
put my
mobile
query.
app or where does this community sit?
So we have two. We have two versions. We started with the WhatsApp. We have a WhatsApp community, and we also
Okay.
have a community on our application. So we are trying out using a third-party application at this time, but we have seen very
Okay.
early success in the WhatsApp communities that we have.
Got it. Got it. Got it. So we are working with one of the kids' mental health chain that is there. So again, I think the engagement on the WhatsApp is really good. At least where it's a small, I mean, city-based communities that are there where people are interacting with each other. It might be a group of maybe say 50 or 100 parents that are there, but very, I would say, connected. And I think the community plays really in the healthcare
Absolutely.
sector. It's really important.
So Chirag, you would be happy to know that we do a lot of competitions. We run a lot of, like events, challenges on our
Ah,
WhatsApp,
okay.
and a lot of people, right? Favorite thing is to do is a screenshot of their meal and their,
Ah,
like if they have done some steps, 1,000, 10,000, 5,000, everybody posts a screenshot. And we also have challenges where people have to do exercises, record and post. Those things are very, very
mm,
popular, right? And we have also run rewards, right? If you do a certain activity, you are eligible for a reward, and
hmm,
those are a big hit, right? People actually, what we feel is want to do a lot of things, but somewhere there is some sort of barrier, and we are trying to
hmm,
uncover, which one is what, and how do we, measure that against success, right? For example, rewards may not be, sustainable forever,
hmm.
right? But we see for certain activities, rewards work. For certain activity, one-on-one motivation, congratulatory
Okay.
messages help, right? People are, people are looking out for these kind of rewards in their
Hmm.
daily life, but
Hmm.
with
Hmm.
diabetes they're always stressed, they're tired of making decisions, so they're looking for these happy
Hmm.
moments, and we try to give them during the program.
No, diabetes that is there. So I think these are the really good initiatives that you guys are running. Go ahead. So your specific role at Fitterfly, I mean, this is what Fitterfly does, but what's on a day to day? How
Right.
does your
So my job is to look at the therapy, right? Does it make sense? From a day one, right? When a therapy design starts, right? We need to look at what is the key areas where a digital program will come into play, right? You need to broaden the
Mhm.
horizon, look at the patient journey end to end, see where does a digital program fit in, what are the areas where we can improve, right? Identify the key
Mhm.
objectives that we need to meet. And from that day, we use our tools, right? So the technology is the tool. We have the application, we have the assessments, you can have the calls, you can have the nudges, but these are the tools.
Mhm.
Using those tools, we need to build the therapy, right? What would day one look like? What would day two, day three, day four? You need to decide. That's your baseline happy journey, but based on certain individuals, right? We need to tweak. We can't expect everything to happen on day one. Something will happen day two. Something may happen at
Yeah.
day 10, right? So you need to deliver that context, right? People with technology background or pure business background may not understand it. For them, it's all like a one
Hmm.
size fits all approach, and which in real life does not work, right? At any stage. So our inputs come in into these nuances, making figuring out what could be the potential 100 different journeys, and how do we
Hmm.
make it flexible for a patient sitting at home, any part of the world, right, to manage their diabetes or any other disease, for example. Let's say we have to tell them to do XYZ, what is the best way to do it so that they understand? It doesn't feel like a burden. Rather, let me do it and I should be happy and I should be rewarded for it. So there are elements of gamification that come in, right? You tell them you have to do 10 different things. At each stage, you give them a reward after clearing a milestone. And then when you finish everything, there is another happy phase that comes in. So it brings the element of, happiness, reward, satisfaction end of the day,
Got it.
which makes the next day's activity much more easier. So as a doctor, we need to identify these nuances and what is the way that we can give the best clinical outcome, right? There is a
Hmm.
specific amount of time a patient spends with a doctor at a hospital. Similarly, there is a specific amount of time a patient spends on their phone and then on our
Hmm.
application. So we need to maximize that time. How do you make sure
Got it.
the engagement is the correct set of engagement, making sure the data is coming in, the healthcare data, and how are
Mhm.
we teaching or educating the members during that 5 to 10 minutes, which all we have, unfortunately.
Yeah. And we also see, I mean, so there are a lot of hospitals and clinics who are, anyways, providing a diabetes care to millions of patients across India. So, if they are looking to set up a diabetes care program, we say, what advice would you give to this hospital or clinic owners on that? It might not be as scalable as Fitterfly type of a thing.
Yeah.
And so that's maybe say a question number one. If somebody is trying to do their own diabetes care program, what type of things from the hospital or a clinic side,
Right.
at least maybe say the building blocks they can do. And the second question, in continuation to that, is does Fitterfly partner with hospitals and clinics to help them set up their diabetes management program? If yes, how does this overall partnership would work?
Absolutely. I mean, that's great. So the answer to the second question is yes, but I'll start with the first question.
Okay.
So for
Yeah.
hospitals and clinics looking for, comprehensive diabetes care program, my first suggestion would be to adopt a very patient-centric approach, right? By patient-centric approach, I would mean understanding what are the core requirement of each patient. Like because your territory would be limited, like what are the key
Hmm.
things that a patient is asking, right? Do they want constant reminders? Do they need support with more nutritionist? Do they need support with pain management, exercise, right? Do they
Hmm.
have a lot of stress, depression, which they have no way to, reach out to? Understand
Hmm.
those things first, because that would be the base of, what are the solutions you want to give. And now set up those solutions in house or digitally and try to serve the people. That is where you create value. And then you capture value by, making them coming back, seeing how they are progressing, showing the outcomes, right? As a digital company, we have all these resources. We've understood these are the major areas where
Hmm.
a typical hospital or a group of doctors lack, right? Many doctors might have nutritionists, but nutritionist would have a specific time she can't or he can't cater to a
Hmm.
lot of patients in a day. That is where we understood that getting technology right as a tool to leverage. If there is a coach today with Fitterfly, the coach can easily manage up to 100 to 200 patients in a day because she's
Hmm.
supported by technology. There is a lot of information already flowing into our systems, and using the insights, a diet plan can be generated automatically and checked by the coach, right? Or if the coach
Hmm.
wants to build it, it's less than 20 minutes for a week's diet plan. Whereas in a
Hmm.
hospital setting, that would take close to an hour because they have to ask a lot of
Got it.
questions again and again. So that those are the hindrances. The next thing is
Got it.
to fostering multidisciplinary care teams. When I say multidisciplinary, it could be the
Hmm.
diabetologist, endocrinologist. You need your physiotherapist for pain management, exercise therapy specialist, your psychologist. Not a lot of hospitals will have all the resources available at the same time for the member, right? Because members want
Hmm.
services at their home at their own convenience. That is again
Hmm.
an insight from the patient centric approach, right? Patients want care at home. How do you deliver it, right, at their
Got it.
demand time? So this is where
Got it.
technology comes in, right? So again, emphasizing preventing measures, right? That's something that
Hmm.
we teach
Hmm.
patients with diabetes. Your regular eye exam, the hand and feet exam, you do your kidney exam, liver exam, regular HbA1c, right? That's the thing,
Hmm.
right? We constantly emphasize them, educate them. A hospital may not be able to do that consistently, right? Only when a patient comes in, they would be able to
Hmm.
deliver those kind of education, and everything comes in together. That's a big
Got
drawback.
it.
Patients would love to have some better connect with the doctor, but the doctor, when they are
Hmm.
always prescribing, this may not have a better effect. So a digital platform where these can be slow trickle down as education really really helps. So that's our value
Got it.
proposition for doctors in hospital,
Got it.
right? We can
Got it.
make these things happen on a digital platform where you own the patient. Like the doctors who have their
Hmm.
patients, they will own their patients, while Fitterfly does these kind of supportive work and help
Okay.
bring that information to you as well. So our the information that we have on those individual patients comes to the doctor
Hmm.
as well. So the doctor essentially,
Got it.
has the visibility of what happened during the last 3 months. If the HbA1c has improved, what was the reason? If it did not improve, what was the reason? Everything is, available.
Got it.
Is there
Got it.
depression?
Got it.
They would know because we have our own assessments. If there is knee pain, if it was 7 on
Hmm.
10, now it's
Hmm.
3 on 10. What was done? They would know. So that's the value add of a digital platform, which does cater to only lifestyle, where doctors can easily, depend on. And if they have the ability to, they want to change medication based on the
Hmm.
information, they can do that. But without
Got
which
it.
most of this kind of, remains as a black box, and doctors don't know if medication adjustment is the right thing to
Got
do
it.
or
Got it.
what would be the
Got it.
best thing for their patient.
Got it. Got it. And if any hospital or doctor is interested to partner with Fitterfly, I mean, what's the best way for them to reach out? Is there any email ID that they can
Absolutely.
reach out to?
So they can reach out to me, my email address,
Sure.
and we have a dedicated team that actually,
Hmm.
caters to doctors. Till date, we have worked with close to 300 doctors across India. So that team
Okay.
is specifically trained to interact with doctors, explain them the process, work with them on day-to-day basis, or whenever they're available. There
Hmm.
is always a
Hmm.
connect available, either on ground or through a
Hmm.
virtual call, where
Hmm.
doctors, demands can be addressed, and a program, if they want to, tweak the program a little bit, it is possible.
Got it.
And we offer them that solution where, diabetes, obesity, hypertension. There are three therapies which are available, and if they
Hmm.
want these solutions available for their
Okay.
patients, they can do through that channel itself.
Great.
It's very much
Great.
available right now, ready to go.
No, I think that is for solving, at least at Navig and in my personal perspective also. I
Right.
feel that hospitals and clinics, they have access to patients and they have the trust. For a digital health company, at least Fitterfly have, I mean, in their long journey, they have established that trust and also they have been able to reach out to a lot of patients. But a lot of health tech companies, if they really, I mean, they are fighting a battle where they do not have the trust. Patient would ideally trust the doctors itself. A lot of things can be solved if both the hospitals and maybe say the health tech companies can come together to serve the patient population. I think that's one of the core agenda for Navig also. I mean, that's what we
Yeah,
believe in, that the hospitals and health tech companies should very closely work with each other.
absolutely. couple of
Yeah.
weeks back,
So,
I was at a conference where folks from UK had come down to India to look for these kind of technologies where they can, take them to UK and set
okay.
their own business up. So yeah, I
Wow.
mean, the world is evolving. I just hope that hospitals in India also, wake up and, explore opportunities amongst us.
No, I think that's a need of the hour, and hopefully we should see some of these things rolling out now. Dr. Vineet, we would be changing gears now. We would start with the general digital health ecosystem in India. I mean, so how do you see the digital health market evolving and growing in India? What all segments or sub-segments that you see would gain mass adoption, and how we can see successful, profitable companies in this space? Currently, there is a lot of buzz around digital health broadly, but we have seen that only there are some e-commerce models like Easy, 1mg types getting large funding and achieving some scale. Broadly, what they are doing is they are into a more of a medicine delivery or maybe say few online consults that are happening. Successes like Fitterfly, where a company has really gone into some type of digital therapeutics and providing actual care to the patients. So those
Right.
companies are very, very less. So would love to hear about your thesis on what would work, what would not work for Indian digital health, or maybe say Indian digital therapeutics space.
Great. So thanks, Chirag. So the major thing that we are seeing, right, as a tectonic shift is patient behavior change, right? Patient today
Hmm.
is asking for care at home, right? At my own convenience, I want care. I want care which is personalized to me. The two different things. And then I have the
Okay.
money I want to spend. And that's a very specific niche. And that's slowly
Hmm.
evolving into, larger population sets, right?
Got
So when we started, tier one was our target, but today we see a lot of people from tier two and below coming in.
Okay.
That's the power of
Great.
technology, right? How are they coming to know? Because they're reading about us in Google search. When they're searching anything
Hmm.
about diabetes, they are learning
Uh-huh.
about the diabetes remission programs. What are the management
Okay.
programs available? They're coming on our website, reading our blogs, and then calling us. This has
Wow.
happened because technology. The consumer today is actually a patient who is looking for
Hmm.
solution in healthcare. They are fully aware that there are pills available from like an online
Hmm.
e-commerce store like Pharmacy 1mg, but they're also
Yes.
aware now that I can treat my diseases online. Even for example, cancer, there are a couple of startups in that space as well, right, who actually deliver all the information on that single platform. Why are they relevant today? Because technology is there, right? So I feel as the patient behavior becomes more and more complex and the overall per capita income improves, more and more people would want to seek care where they are for themselves and their
Hmm.
loved ones, right? So that means even as a bigger hospital, you would need to, be more in touch with these people. So a care through a mobile app would become much more norm, right? So that's the reason, right? Apollo, for example, 24/7 is going
Hmm.
through a lot of, intensive investment phases, and they want to
Yeah.
explore, a lot of
Hmm.
opportunities in that space. So, and they've also included a lot of, digital program for various
Hmm.
diseases similar to ours. So that's a space I think I would see a lot of progress, right?
Great.
People in India are unfortunately suffering from lifestyle diseases.
Hmm.
People in India are suffering from a lot of mental health diseases, unfortunately. Pain is also a very significant part. Physical
Hmm.
fitness is something people value. So we
Hmm.
see Cult Fit. They are an online platform where people learn to how to exercise right at their homes. They are also a pretty much relevant part of the healthcare economy right now, digital health economy. So
Understood.
diet, fitness, mental health will always flourish going forward. And when you look at diseases such as diabetes, obesity, you need to really understand what the patient is looking for. And companies which are really solving a problem that is relevant
Hmm.
will be successful. My advice
Got
or
it.
my insights from the industry search and looking at the trends would be that solutions that really understand the consumer or the patient
Hmm.
as a core, and then solving the problems, their problems, as well as keeping the doctor in the loop, right? Those are the
Got it.
solutions that would really, really flourish.
Got it.
So the
Got it.
e-commerce boom was the initial phase, but then now the next
Yeah.
phase would be, how do you understand the consumer, solve their critical problems, keeping them in mind
Got
as
it.
well as a doctor in mind.
You also mentioned that a lot of your patients are coming from tier two or maybe say tier three cities. So, any specific percentage, maybe say, how would you draw a pie tier one and metro versus tier two, tier three city right now?
So I can give you the stats around tier 1 versus tier 2. It's 50-50.
Oh, wow. And that specifically, I would say the tier two growth happened in the last 2, 3 years, or how
Yeah,
is it?
yeah, it's
Okay.
recent. Because as more and more
Eh,
people go into the net, look for
Hmm,
solutions,
hmm, hmm.
it's equitable, right? Information today is equitable. Even if you are in
Yeah.
London, Delhi, or a very small town in Maharashtra, you are
Hmm.
getting the same information. And that is the power.
Got it. Got it. And a lot of companies right now, I think you did mention about a Google as a channel. But according to you, what might be the right channels for a health tech company or a digital health company in their initial years if they have to? Because see, at the end of the day, brand would not have been established. Right now, Fitterfly, I mean, you have the luxury of, I mean, both in terms of being one of the earlier players, plus at the same time, there is a lot of credibility that has been built because of actual patient outcomes. There are a lot of health tech companies, maybe say, who are starting right now. And patient trust or maybe say that visibility is not there. So, what would you advise more in terms of it might be more digital, but what are your thoughts in terms of patient acquisition in the initial year one or year two for a health tech company? I mean, what are the channels that they can leverage?
Right. I mean, Chirag, that's a million-dollar question, I would say, right? So in our case, we were blessed that our founder was a renowned surgeon, right? Dr. Singhal was
Yes.
already
Ah.
practicing well in Navi Mumbai, very well known in the pediatric urology
Hmm,
space.
hmm,
That may not
hmm,
be the luxury that most startups would have, right? Those connections would not exist for a startup. So,
got it.
and get going through social media, the performance marketing channel is super expensive. It takes a lot of money
Hmm,
to reach out to potential
hmm,
patients using a social media platform. With
hmm,
those in mind, I think the first thing I would definitely recommend a non-medical or a doctor who is young in his practice when he
hmm,
starts up, when he or she starts up, would be to get the right mentorship. I think a senior doctor, or please get them on board, make them your champions, right? More the better.
ah,
The better
got it.
connected they are, it works well for you. Get doctor associations like the IMAs,
Hmm,
or in
hmm,
case of diabetes, it's called the RSSDI, right?
hmm,
These are the forums where more and more doctors come and interact. They do yearly conferences, monthly meetings. I think that's the
hmm,
platform where the founders need to go, interact with doctors, get their advisors to come and be their
hmm,
champion, right? And
hmm.
then produce data which can give evidence that the solution works. That's the path
Okay.
we took, right? Although we had a doctor as a
Hmm,
founder, but
hmm,
we were very focused that data has to be there, evidence has to be generated, it has to be presented and published, without which we don't get doctors to, trust us and, refer their patients.
hmm.
Most doctors will ask for data, evidences, and that is how you can win them over any day, right? You need to show evidence that the solution works. And if you have a senior doctor championing you, saying, we
Hmm.
have seen the solution, we have seen the data, this works, and I can stand with it. I think that's how you can, win more and more doctors. And so that's how you can, build your doctor channels.
Got it. Got it. Yeah, I think that's I think very insightful because a lot of people who would be coming from a non-medical background, at least the health tech founders, they would have built a great stuff, and maybe say clinically also they would have validated it few of the I would say some of the known doctors, but then to get the patient trust and build the platform at scale, few seniors doctors who are really championing your product. I think that's the one of the key things that are
Right,
there, and maybe say on that they can build their content and the overall strategy to get into more of a patient acquisition play that is there.
right.
Got it. Got it. Vineet, one of the maybe say it's too early, and maybe say India is known for not having a lot of compliance and everything, even in the patient data privacy and everything. But can you touch upon the regulatory and maybe say some of the compliance related aspects to be followed in India for launching a digital product that is the digital health product? And
Yeah,
what are the challenges that you see in the current context, and what suggestions you might have for a smoother adoption of the overall digital health ecosystem?
great. That's a great question, Chirag. So, as a digital company, digital health company catering to patients in India, there are strict regulatory requirements, right? You need to have a quality maintained at your software. Your data needs to be
Hmm.
secure. There are multiple requirements in terms of data security. So there are, certifications called as the ISO certifications that each company
Okay.
has to get it. They have to be verified by a third party. There are also systems where it's mandatory to, record each activity in terms of your technology development, right? They are also
Uh,
important, right? How you build your technology, what are the things you used, everything has to be documented. So documentation becomes very important for quality management. For SAMD approval, that is software as medical device, there is a
mhm.
certification called ISO 13485. Again, one of the
Okay.
ISOs, many ISOs. So you need to get
Yeah.
that,
Yeah.
approved, and there are third-party consultants and approvers that would help you get there. So as a company, we may not have the resources to do it, but we take care of third-party agents who come and support us and teach us
Got it.
the regulatory steps. So as a doctor,
Got
I
it.
wouldn't want you to worry about it. There are
Hmm.
sufficient resources available that can help you get those certifications. And then there are requirements by the CDSO, the Indian authority, Indian FDA, I would say. They have
Mhm.
certain requirements where you fulfill these ISOs and then you apply for a device certification, right? For us, we are class B device. There are other devices could be class C and D as per your device's complications and the complexity of the treatment and the diseases,
Mhm.
the numbering that changes. So we are a class
Okay.
B medical device, and
Got it.
we have recently got the certification, and we did take support of a third party to help us get there. So no need to
Got it.
worry. There are strict requirements which can be done if you take the
Understood.
right support.
So, Dr. Vineet, primarily, I think broadly this we touched upon various aspects. If you feel that any other topic you would want to share with the Navig team, or maybe say anything specific for Fitterfly, we would be happy to hear that.
Right. So at Fitterfly, we are looking at collaborating with more and more doctors, right? I feel there is a gap where doctors are not really aware of the ability of lifestyle that can contribute
Mhm.
to diabetes management. So that is something we are actively looking at, giving it from an education perspective, showcasing results, right? We are actively
Mhm.
involved with, engaging doctors across the globe. Actually, we are currently working on a study where we're trying to build a consensus around how and when to give lifestyle as first line of therapy. So we want
Okay.
doctors across India to
Okay.
believe lifestyle should be the first line of therapy when diabetes is diagnosed, or there is obesity, or there is hypertension.
Hmm.
Because in India, most patients do not want to get on medicines. That's something, again, another
Yeah. Yeah.
insight I'm telling you. They just don't want to get on medicine. They want to try lifestyle, but they are
Hmm.
struggling because nobody's telling them the right way to do it, because
Got it.
nutrition has to be done scientifically, right? It should
Hmm.
match the individual's needs. Again, if fitness is a problem, patient is not exercising, there is a way
Hmm.
to motivate the member to do it slowly, steadily, track progress, increase intensity, so that end of the, let's say, 3 to 6 months, patient is exercising. Mental health is a very, very unmet need, right? Especially in diabetes. Depression is very, very common. Anxiety is common. Frustration is very much common. So
Hmm.
there are solutions available to cater to all these requirements. So if doctors focus on all the elements around diabetes, around lifestyle, there is a strong possibility that we might kind of, put brakes on the diabetes progress in India.
Got it. Got it. Got it. Think uh, a lot of us know, but at the same time, as you rightly said, in a clinical primary type of a setup, all these things take a backseat, where
Correct.
people are just going to be cured for a particular sickness that they might be having. So I think with a platform like Fitterfly, and maybe say more such digital health companies that are there, uh, overall, we should see some kind of a positive improvements in the coming years and maybe say decades.
Right.
So I think a wonderful discussion we had, Dr. Vineet. It was a pleasure to host you. So again, thank you for the wonderful discussion, Dr. Vineet.
The pleasure is all mine, Chirag.